Today let's talk about the histopathological aspects of dental caries. In a broader aspect, dental caries can be categorized into caries of the enamel as well as caries of dentin. Of course, you observe cemental or root caries as well, but for a broader aspect, let's categorize or let's deal with only these two conditions today. Okay. So when we talk about caries of the enamel is basically comprised of rods. Okay, enamel rods which are oriented in different directions. Like when we talk about the occlusal area, they are oriented occlusally or perpendicular to the DEJ. And as you go to the cervical region, they go horizontally as well as obliquely, more cervically or apically. So in the enamel, basically we have occlusal or pit and fissure caries and smooth surface caries. So when we talk about the occlusal caries, the point of entry, if we notice, is the deep pit or fissure, which is the deepest part of the oral cavity or which is deepest part of the tooth. So this pit or the deepest fissure, which acts as a source of entry of infection, entry of bacteria into the deeper parts of the tooth. So it spreads along the enamel rod and takes the shape of a cone or a triangle. So if you observe, this shape would be somewhat a triangle or a funnel shape, where the apex of the triangle would be towards the external surface of the tooth and the base of the triangle would be towards the DEJ or the dentino-enamel junction. And when you talk about the smooth surface caries, unlike the occlusion pit and fissure caries, here the apex would be towards the dentino-enamel junction and the base would be towards the external surface. Most of the times, this type of caries or the smooth surface caries, when seen in an extracted tooth, would be presenting like a white spot, kind of a white spot. So otherwise if the tooth is not extracted, you will not be able to see these kind of caries most commonly. So now we understood how the caries progression happens in the enamel. Now enamel is basically comprised of enamel rods or prisms. So enamel rods or prisms. So basically these are enamel rods and you have the inter rod or interprismatic material. So in the early carious lesions, what happens is that this interprismatic material will be lost. So having lost this interprismatic material, these borders surrounding the rods will become more prominent. So these borders or the delineating between the rod and rod are called as, you find certain lines called as incremental lines of Ritzius. Incremental lines of Ritzius. So these lines become more prominent in the early carious lesions. And the external manifestations of these lines are called as pericymata. So they also become prominent in the early carious lesions of enamel. So this is what is basically observed in the early carious lesions of enamel. So we spoke about the shape of the caries, whether it is a funnel shape, and how the base and the apex are oriented in case of occlusion or pit and fissure, as well as the smooth surface caries. And we spoke about the histopathological aspects like the loss of interprismatic material and the prominence of pericymata and the incremental lines of Ritzius. So now if we look into the advanced aspect of enamel caries, they can be categorized into like several zones. So these zones, if we observe, are noticed from the DEJ to the external surface of the tooth. No? Now getting into the further details of the advanced progression of caries or the advanced aspect of caries lesions. So like we can categorize them into certain zones. So certain zones were basically observed under a microscope in the advanced cases of the advanced progression. So those zones are categorized as the translucent zone, the dark zone, the body of the lesion and the surface zone. So basically these zones are from the DEJ to the external surface. So how are these zones basically categorized? On what basis the zones were observed? So those zones were observed based on the pore volume. See, we all know that enamel is made up of rods and cones and enamel prisms, which are at the hydroxyapatite crystals. So basically it is porous. So and also, so based on the pore volume as well as the mounting medium. That is basically these are observed under a microscope. So we need a mounting medium to observe. So and also the mounting medium. So on which medium or on how they are observed under the microscope. So whether it is a transmission microscope or a polarized light, how the structures were observed. So basically on these two, considering these two aspects, that is the pore volume as well as the mounting medium, those four zones were demonstrated. So if we look into the further aspect of the zones, like when you talk about the translucent zone, okay. So first let's talk about translucent zone, okay. So why is it called as translucent zone? This zone is considered in the advancing front of the decay. Like just beneath this zone you have the TJ or the dentin, okay, like dentinal tubules, okay, dentin, fine. So this zone is considered as the advancing front or the deepest layer of the enamel caries, okay, and it is not much porous. So the pore volume is considered to be like 0.1% pore volume will be present here when compared to the regular, the sound enamel of 0.1% pore volume of the sound enamel. So here the pore volume would be around like 1%. Is 1% porous when compared to the 0.1% pore volume of the adjacent sound enamel or the uninvolved enamel. Now, basically here the mounting medium which was used was quinolone. Okay. When the quinolone medium was used, they observed, and when the the structure or the tissue sample, the heart tissue sample was imbibed with quinolone and observed under the transmitted light. So when they observed this under a transmitted light, they found it to be structureless or translucent. Okay, that is why it is known as translucent zone. Okay, it is not mandatory that this zone should be present in all the carious lesions involving enamel. Okay, this need not be present. Though it is the advancing front, this zone need not be seen in all the carious lesions. Okay, and when we talk about the second zone, that is the dark zone. Okay, in the translucent zone, it was also observed that there is increased fluoride content. So this could be because of the proximity towards the dentinal tubular fluid. Okay, so and so this is about the translucent zone. So now coming to the next zone, that is the dark zone. So when we talk about the dark zone, why is it called as dark zone? See here we discussed that basically these zones were categorized based on the pore volume as well as the mounting medium. So here the mounting medium used was quinolone. Okay, quinolone is the mounting medium used. So in the dark zone, why is it called as dark zone? Because the ground structure, the ground sections which are prepared when they were imbibed with quinolone, okay, and observed under the transmitted light, okay, when they are imbibed with quinolone and observed under the transmitted light, they, this zone has been observed as brown color, something like this. This is the brown color beginning, this beginning of not this black structure or the dark blue structure, the brown structures, okay. This is a beginning of the brown color lesion. So hence it is called as dark zone. See, this is a zone where the carious lesion is in progress, okay. So that is why this zone is called as a dark zone, because it is observed dark brown in color, the ground sections when imbibed with quinolone, and observed under transmitted light, they give a dark brown color, and hence it is called as a dark zone. Now what about the pore volume or the pore content? See, the dark zone is 2 to 4% porous when compared to the adjacent sound enamel, that it is comparatively more porous. And an important point is that they said that this zone is known to exhibit the positive zone. This zone is also called as a positive zone. Why is it called as positive zone? As we discussed earlier, the translucent zone need not be present in all the advancing lesions, whereas this zone has to be present, will be present in all the carious lesions, okay. So hence it is called as positive zone. And when this zone was observed under the polarized light, okay, under the polarized light, they observed something called as positive birefringence. Positive birefringence. What do you mean by birefringence? Refringence means refraction. Birefringence means double refraction. Refraction means bending of light or splitting of light, okay. So this zone, this dark zone, is known to exhibit the property of birefringence under the polarized light. It is also called as a positive zone because it is ought to be present in the advancing carious lesions, and when observed under the transmitted light, it gave a color of dark brown color, and it has a pore volume of 2 to 4%. So this is about the dark zone. And what is the clinical aspect about this zone? This has to be removed, of course, during the carious excavation. Okay, during the caries excavation process, this has to be removed. Now let's go into another zone, that is the body of the lesion. Now let's talk about another zone, that is the body of the lesion. This is, here we are talking about the body of the lesion, which is next to the surface zone or the layer beneath the surface zone. Okay. This is the body of the lesion, that is, this is the area of greatest demineralization, okay. This is the area of greatest demineralization, that is, this is the softest part of the decayed part. This is a soft decay and this has to be removed, okay. This cannot be kept, and this is a main source of bacterial infection, okay. This zone has to be removed during the clinical caries removal process, okay. And here, if we look at as we told that this is the area of greatest demineralization, so the pore volumes are like, in the center there is 25% of pore volume compared to the periphery where there is 5% of the pore volume. So, okay, so, and this zone is like, also known to exhibit the positive birefringence like the dark zone, and when observed under the polarized light. And here the mineral content is found to be the least. That is why we say that the area of greatest demineralization. So this is about this is also the positive zone. This also is present. This zone is also observed most of the times during in the advancing carious lesions. Okay. And now let's talk about the surface zone. So this is a superficial zone. Here the pore content. This is a superficial zone. This is also the positive zone, and here the the pore content would be less than 5%. This area is not the mineral content is also comparatively high because of the salivary source of minerals and remineralization happening. Okay, so this is about the histopathology of the early and advanced carious lesions of enamel.